My internships are what I'm sure landed me every job offer that I've gotten since being out of school, because it just shows that you were able to put your learning into practice. So it's definitely, I would say, besides networking, the biggest asset that you could have on a resume.
Yeah, I agree. No doubt about it. I mean, unfortunately, Samantha, as I told my previous guests and audience, probably know that my internship was in 1991 during Desert Storm. And so that was not business related. Okay, that was not real helpful in me getting a job when I got back. I was a clerk, a maintenance clerk, and probably a maintenance clerk. I could probably be maybe working at Ozone or somewhere like that, or working in the park department at Walmart. That's probably what the internship did there. And so that's why I stress internships so much these days towards students, like to really give you a start job, or get you start off in the right direction as far as your career is concerned.
Yeah, and there's sometimes that even internships can show you what you don't want to do for.
Hello, everyone. Welcome to the Career Education Learners in the Podcast. I'm your host, Mitchell Rivers. I am thrilled and elated and honored to have Samantha Huneycutt on our show today. Samantha is a graduate of East Carolina University and has a master's degree in public health from the University of North Carolina at Charlotte. How are you doing today, Samantha?
I'm so good. Thank you so much for having me. How are you?
I am fine, and thank you so much for coming on our show. Samantha, tell our audience a little bit about yourself and your journey to your current career.
Well, for the longest time of my life, I wanted to be an ER doctor or a trauma surgeon. And East Carolina, I went there for college because I needed to get away from Mooresville for a little bit. But turns out they didn't have a good pre-med track. So I started in biology. And then after my freshman year, I did not like biology anymore. So I switched to public health, not really knowing anything about it. It was before COVID, but I didn't really know what it entailed. So I I went with it, and I actually started to love it. And, but I didn't know any jobs that you could get with public health. So I started looking into it, and then I found epidemiology, and I loved it. And then COVID hit, and right around that time I was graduating, I got to work on a COVID study as an intern, studying the trends and patterns like at the height of the pandemic. So that was really cool to see. We saw some of the first cases of like a reinfection or an infection after vaccination. So I worked on that right out of undergrad. And then I applied to UNCC for their Master's in Public Health program, and I got in. I moved back to Charlotte, and I started doing that. So it's a little bit about me. It's been a long journey. It was hard to keep up with academics throughout the pandemic. Here we are.
Well, how is that transition? I mean, I know you want to get out of Mooresville. And so how is that transition going from a small town of Mooresville going to a big university at East Carolina?
It wasn't that bad. It was actually pretty easy just because I've lived in the suburbs of Charlotte, so I'm used to like big crowds of people. And so going to East Carolina, it honestly felt the same. And because there was such a large crowd of people my age, it was pretty easy to make friends. So I really enjoyed it. I do miss going out there, and I do miss East Carolina, like the feel of it and the surrounding people. But it was good. I really liked ECU, but COVID hit middle of my junior year. So pretty much everything after that, my friends moved away and I moved back home and did school online. So yeah, but I got a good 2.5 years out of it. So
did you get to go back to the campus before you graduated during that time, or did you just go online and then you went ahead and graduated from there?
So when COVID first hit, they shut down the university completely right after our spring break. So I moved back home and I was just doing classes online. And then come my senior year, so the fall of 2020, they said that everybody was going to go back in person. I still had my apartment out there that I had re-signed the lease in case I needed to. So we went to in-person classes for a week, and then they were like, the transmission rates are too high. We're putting everything back online. So, but at that time, I would say about 2 weeks that you'd still doing classes online, but still around campus, would get to see my friends. And then I would come home for an extended period of time and kind of flip-flop back and forth.
Yeah, and so I know it's very difficult for a lot of students, whether in high school or college, to go through those transitions. And I've spoken to past guests about that, and I can't imagine doing that. Fortunately for me, my kids were not in school then. As I told Samantha earlier, my kids are grown adults. And so that was fantastic from my standpoint. And I think we all had to adjust during that time period. And so it had to be very, as far as you had to be very adaptable, Yeah. You're going back, you're coming out, you're going back, coming out. And then, you don't really get to spend your senior year like you thought to, right? Your freshman year, you say, wait till I come in senior. Wait till I come a senior. I can't wait. And then all of a sudden, this pattern, what you end up studying about, came about. How did you get into that study, though? Because, that's not, did you have a role model, or did some you just see something on TV that prompted you to become into public health?
Really, it was kind of just because I did join the public health program and I didn't really know anything about it. It was just a different major than biology, but still within the healthcare realm. And then I started looking into it because I was kind of in that weird transitional period that I didn't know what I wanted to do. I knew I didn't want to do biology, but didn't have a good pre-med track. They have a great medical school, but not a whole lot of things other than nursing to get you to that medical school. So, and I kind of just looked up potential careers in public health, saw epidemiology, took a class in it, and I loved it. But it was definitely a transitional period during COVID, excuse me, with everything going online. And there's not a certain person you can blame for it. You can't blame the university. You can't blame the professors for creating this kind of bad. I wouldn't go as far as to say bad, but this this learning environment that's not equitable to everybody's learning type. And because this was unprecedented for them too. So everybody was kind of in the same boat, from the higher ups at the university down to the students. So it was a learning pattern for all, but I think we did the best we can. Looking back, I would say there are different strategies that could have been used to be able to get everybody to adapt to it. But yeah, I would say everybody did the best they could given what they knew at the time. And then, so I was still on campus and I needed an internship for my last semester. So I actually got to walk the stage at graduation, but I still needed that internship before I got my diploma. So I was looking up and down, and there's not a whole lot out in Greenville because it's really just the university. And
so everyone did have a transitional period. Not only at college did they have a transitional period, everybody in the world had a transitional period. And so, the school officials was puzzled, work environments were puzzled. It was just a unprecedented time. Now, did that help you as far as your study doing the public health? Did you learn a lot during that time period as far as if you look back on it and seeing the trends that happened then?
Yeah, so I was definitely able to see everything that we were learning in class in real time and unfold, and be able to basically put my knowledge into real world practice, which doesn't really come a whole lot in studies while you're an undergraduate. There's not a whole lot of opportunities to see how things are going on at a national level in your field. So I was very lucky in that I was able to kind of watch that. And so I needed that internship after my undergraduate degree. And so I just found one working on a study with a professor in the graduate school who was an epidemiologist who actually worked for the CDC. So I was able to obtain that, and I worked from May until August. And I did a lot of data entry. So how the study worked, we put together kits and we would give them we had about 250 study participants, and we would give them self-administered nasal swabs that they then had to send into the state lab out in Raleigh. And then we would get those results back. We were able to track antibody levels with a monthly blood draw, and we were able to track their vaccination rates, mandate adherence, so social distancing, mask wearing, PPE, things of that nature. So we were able to track a whole bunch of different like statistics, and then we would meet with state health officials to see where the trends are going, if they're up one week and down the next, and kind of gauge what we should be doing at the state level in terms of mandates and things that should be going on to help the spread of it. So it was very insightful, and it was cool that like I got to work on something that monumental right after obtaining my degree, because a lot of people don't really get to do that.
Not even a lot of people, hardly no one gets to do that, Samantha. Yeah. No one gets to do that. That is fantastic. I mean, you got to actually do what you studied during that time right after. I mean, that hardly ever occurs, only probably medical school people, where they have to do it, but other than just having a regular major, like me, a business administration major, there's a difference between the books and actually doing the work, right? The transition, but you actually got to do it at the same time. That is incredible. And that's why I also preach here at the Career Education Learning Center about the importance of internships. You got to learn a lot about internships. Now, why did you decide to go to UNCC for your master's degree?
So there were a couple so there's not a whole lot of schools in North Carolina that offer a master's in public health. And the other ones were Duke and UNC Chapel Hill. And I'm going to be honest with you, I did not have the grades to get into either of those. So I was looking, and I was kind of looking out of state there for a little bit. Like University of Michigan has a really good program. University of, I believe it was Central Florida, has a really good program. But then I found one that's more recent than not at UNCC, and they had a concentration in epidemiology. And I was like, perfect. And so I applied to that while I was doing the COVID study. I actually got offered a full-time job on the COVID study, but I was like, you know what, if I don't go to graduate school now, I'm never going to go. I am once I'm out of school, I am going to be out of school. But it was a very spontaneous decision to go. And I would say I applied too late to go for the fall semester. So right in August, as soon as I got done with the study, I got in for the following spring semester. So January of 22. And so I moved back home. I denied the full-time job. I moved back home. I worked at the same bowling alley that I worked at throughout college whenever I would go home for the summer. And then I started that. And I liked UNC Charlotte for the most part. There are a few things that I definitely think need to be altered or changed. But for the most part, it was a good experience.
Yeah, and for the most part, nothing's going to be 100% to your liking in a sense. And if it's a new program or early program, less than 10 years, then I'm pretty sure there's kinks and other things here they're trying to work on to improve the program and improve what they're trying to accomplish as a department. And so if you liked it pretty much and you made it through it, which is fantastic, that is all that matters there. Now, I've seen on your profile where you do a volunteer 9 functions. That's something called 9 foundations. That's it. 9 foundations. Can you tell us a little bit about that?
Oh, that was just something that I like reposted.
Okay. So have you ever done something with 9 foundations, or did you appreciate what they do at 9 foundations?
Oh, I definitely appreciate what they do. They're very like innovative in the realm of public health. So I like to follow a lot of their posts and see the kind of work that they do within the community with other public health professionals and things of that nature. So I like to keep up with them. I like to keep up with a lot of different public health foundations and kind of see the tracks in which they're taking it and how they help community members on different levels, whether it be local, state, federal, international. So yeah, it's definitely interesting. I love to keep up with like very modern things happening in the public health realm. So
I think that's good. I think that's part of your study. I think that's you as a public health official should do, to be honest with you. That's why I mentioned that. And that you're always learning, Samantha. I mean, there's no time you're not learning, increasing yourself, broadening your horizons. And like you said before, that may come into play later on in your career. You never know. And keeping up, and I tell students all the time, keeping up with the latest trends, especially within your field of study, is fantastic. It's broadening your horizons. You look at things from a different angle. So that way, when you come about problems in the future, then you know how to handle those problems. Say, there's something similar to this problem that I came across before, and maybe that can help out with what I'm looking for. And so that is something that I think is important for students to know, is that, hey, get involved. get involved with organizations, get involved with people, get involved with networking, and that is important. Now, do you do any volunteering, or you're a part of any organizations?
Yeah, I definitely do a lot of volunteering. For a time, I was volunteering with the Graves' Disease and Thyroid Foundation. So I write like little forums posted on their webpage, and I educate fellow like community members on thyroid disease, which is what Graves' disease, which is just a hyperactive thyroid condition. So I like to educate on that. I would do a little volunteering within my community just whenever it pops up. But I would definitely say networking is your biggest opportunity to be able to like advance in your career. I can't even tell you how many people that I met within my public health program that I know 10 years down the line, if I have a question and I'm going to remember, oh, they were really good about that in school. And I became very close with a lot of them. So I know that I could reach out and ask about any kind of questions that I would have. And it's very important to keep up those relationships with people, even if you think that they're not going to be useful down the line, like you never know. And the importance of internships is it helps build a resume so much more than you know. I had to get an internship while I was also in graduate school, and I worked at Novant Health Presbyterian Medical Center down in Charlotte. And I worked in the trauma department in a little subdivision called the injury prevention ward, I would say. And we worked with sexual assault nurse examiners, and I studied the trends and patterns of sexual assaults and child abuse, neglect, things of that nature. And we did a lot of community volunteering where we would go out to different summer camps, because this happened in the summer of 23. We would go out to different summer camps. We would educate children on the importance of violence prevention, safety in terms of like water, sports safety, concussions, things of that nature. Pedestrian safety was a big one as well. And we would do seatbelt checks. So we would have big events where people could come out and get a car seat, and we would be able to show them how to use that with their small children and things. People that were under-resourced, I would say, were able to come out to these big events that Novant Health would put on, and we would volunteer at those. And I did that, I would say probably like 15 hours a week. So it was always constantly, we were out in the community. We were out trying to provide resources and help for families and community members that didn't really have it before. So it's definitely important to be able to actually connect with these people instead of just sitting behind a desk and saying that they have a problem, but not doing anything to actively help it. So my internships are what I'm sure landed me every job offer that I've gotten since being out of school, because it just shows that you were able to put your learning into practice. So it's definitely, I would say, besides networking, the biggest asset that you could have on a resume.
Yeah, I agree. No doubt about it. I mean, unfortunately, Samantha, as I told my previous guests and audience probably know that my internship was in 1991 during Desert Storm. And so that was not business related. Okay. That was not real helpful in me getting a job when I got back. I was a maintenance clerk. And probably a maintenance clerk, I could probably be maybe working at Ozone or somewhere like that, or working in the park department at Walmart. That's probably what the internship did there. And so that's why I stress internships so much these days towards students, like to really give you a start jump, or, get you start off in the right direction as far as your career is concerned.
Yeah. And there's sometimes that even internships can show you what you don't want to do for a career. So it's definitely important to get out and get that experience. And I was lucky enough that I had both my internships in the COVID study and at Novant Health that pointed me in the direction that I want to go. But I had some classmates that they had internships that they absolutely hated. And I told them, I was like, look, at least now that once you get out of school, you don't want to apply to jobs in that realm. Mm-hmm. So that's totally okay too. It's meant for a learning process, which I think is so cool. But I was lucky enough to have ones that I really did enjoy.
Yeah, and I said that before in previous podcasts. You read my mind. Are you reading my mind, Samantha? Are you reading my mind? Because apparently you are. Because I've stated it before, is that sometimes you learn an internship what you don't want to do, right? Like you took that biology class and you said, this is not for me, right? So sometimes you go into a situation where you learn not what to do. It's like having a manager. You have a good manager or a bad manager, okay? You take what's good from the good manager and you throw away what's bad for the bad manager. And so, you know what I'm saying? You're going to learn either way, you know? It's like my mentor told me, he said, Mitchell, your business is working for you or it's working on you, but either way, it's working.
Yeah.
I feel like it's more working on me than for me. So, Samantha, how are we doing as a country in public health? Are we getting better as far as preventive medicine and prevention of accidents and other trends that may be trending the wrong way? Are we getting better and improving in public health?
In some realms, yes. And I would say in others, no. Like in some realms, in terms of preventative measures, you know, screenings, early detection of cancers, things of that nature, I would definitely say we're moving in the right direction. And I would say we're honestly the top country in the world. Like we are so lucky to be able to have these screening measures that prevents a lot of mortality and morbidity in a lot of these chronic diseases. And in terms of cardiac, pulmonary diseases, things of that nature, like you are able, if you get on it quick enough, if you recognize the signs and symptoms and you go get tested for certain diseases and I cannot stress enough the importance of going to yearly checkups, whether it be with your primary care physician, whether it be if you're a woman getting a mammogram, going to a dermatologist, if you've been out in the sun, like things like that. It will help so much in early detection. So I think we're one of the top countries in terms of that. But in terms of some other diseases, I would say we're more neutral. We're not the best, but we're not the worst in terms of like, we have a lot of disparities between, you know, people of color, different socioeconomic statuses that a lot of other countries aren't really experiencing. We have a really bad problem right now in maternal mortality because unfortunately, and I hate to say this, but our healthcare system views patients, or it has in more recent years, as an income source.
Yes.
So people walk through the door and they see it as a potential to make more money. And that's why a lot of primary care physicians and a lot of doctors are very quick to send you to a specialist because they get money for that referral and things of that nature. So it's become more of a business rather than focusing on the patients. I think we are finally getting to a point after COVID and after that whole healthcare, everything going wrong during that, we're finally getting to a point that we are kind of moving away from that because I think people are starting to realize how bad it's really gotten. But maternal mortality is definitely something that was trending in the wrong direction. Vaccinations, I won't go into a whole rant about that, but there are a lot of diseases that are coming back because people have such a fear in the healthcare system now after watching how things were handled with COVID that they don't want to. And there was so much, you know, surrounding the COVID vaccine and whatnot.
The misinformation and information here. And I think as a public health official and public health in general, we just had to get those messages out there. Somehow we had to get those messages of preventive measures, and you have to somehow get that message about fear of vaccinations, you know, and it's out there. And so as a country, I feel like personally that we just have to improve, you know, those things when you say we are going the wrong way, we have to find a way to reverse that trend. And those things that we're doing well, we need to find out to maximize those trends. And so no country is perfect. And I know healthcare is a big topic in ours. You know, we have that thing to where it's needed and we know it's needed, but we're trying to combine a capitalist system with healthcare system. So since we don't no longer, like when I was growing up, most of the healthcare providers in the 60s and 70s and below was nonprofit. Now they're for-profit. And so we're trying to find that balance between making a profit and serving our communities. And we're still in the middle trying to find out how we can best do that. And so that's just the part of the country that we live in. But I think people like you and other healthcare officials are trying to improve that. And we're going to get there. But getting that message out, helping squash some of that fears that our people have in the community will help go a whole lot way. Do you have any parting words for our young people who may be watching this podcast at this time?
I would say definitely don't go down a track if you're really going to be unhappy in it. I thought that I was so scared once I realized I didn't like biology. I was like, I'm already in this in college. What am I supposed to do? And it's never too late to do something. One of my favorite quotes is like, Vera Wang didn't design her first wedding dress until she was like 50. And Harrison Ford didn't become an actor until he was 50. And at 30 years old, he was a carpenter. Like, it's never too late to change your mind, to want to do something different. If you realize something is not for you, don't try and push yourself in a field that you know you are going to be ultimately unhappy. And sometimes it takes some people longer than others to find what they really like. I was fortunate enough that I found it very early on, and I was able to build from there. But if you are still in college or in high school and you really don't know what you want to do with your life, that's completely okay. And the opportunities will come. It's just, it's okay if you're 20 years old and you don't know what you want to do with your life. It's different for everybody. So don't compare your track and where you're at with life with others, because everybody moves at their own pace.
Yeah, I agree with that. I tell you what, I really do agree with that. As I said before, is that everyone is different. And I, like you said, don't compare yourself. So that parting words were very good for me and for my audience. Don't compare yourself. Take your time. We're all different individuals. You have late starters, like you say, you got Harrison Ford, you got head in my head, Morgan Freeman, even Bruce Willis, that started late, you got Colonel Sanders real late, you know what I'm saying? And so a lot of people start late, some people early, as we know, early child actors that did well. But everybody's different and everybody has a unique journey in their life. Exactly. And so I recommend, like you said before, just take your time, do what you enjoy. And along the way, hopefully you can discover what you like to do or don't like to do, right?
Yeah, exactly.
And don't like to do. So Samantha, thank you so much for coming on the show today. I really do appreciate it. And I only want the best for you.
Thank you for having me. I had a blast. I was so excited when you asked me to be on this, but I had a blast. Thank you so much for allowing me to talk to your audience about my educational and professional journey so far.
You're welcome. And I'd like to thank our viewers and listeners for joining me on another episode of the Career Education Learning Center podcast. We're making your career dreams a reality. God bless.